Okay, good evening and welcome to our community forum on fentanyl use in our Lanark, Leeds and Grenville communities, as well as its impact on our youth. Our apologies for the momentary delay due to a couple of technical difficulties. My name is Don Lewis and I'll be facilitating this evening's virtual session. I'm a superintendent with the Upper Canada District School Board, and we're joined this evening by Marcia McNair, Superintendent of School Operations from UCDSB, Norma McDonald, Superintendent of School Effectiveness with the Catholic District School Board of Eastern Ontario, Michelle Neville, Mental Health Lead from CDSBEO, Jen Adams, Registered Nurse, Harm Reduction Coordinator with Leeds, Grenville and Lanark District Health Unit, Jess Bashara, Harm Reduction Community Support Navigator with the Health Unit, Christine Dinnery, Opioid Counselor with Lanark, Leeds and Grenville Mental Health and Addictions, Tom Fournier, Staff Sergeant with Brockville Police Services. We would like to thank all of you who are taking the time to watch either live or who will do so later as this event is being recorded. This evening's event came about as a response to the ongoing fentanyl crisis that we're seeing in our communities, as well as the impact it is having on some of our youth. In a couple of moments, I'll turn things over to Jen, Christine, Tom, and Jess to talk about what we are seeing in our communities with regards to fentanyl use, the supply, and accessing support. After which we will have a presentation about the programs that school boards are doing, and we'll finish with the Q&A session with members of our panel. So it's my pleasure now to turn things over to Jen, Christine, Tom, and Jess to talk about what we're seeing in the communities right now with regards to fentanyl.
Good evening, everyone. I guess I'll start in, my name's Tom Fournier. I'm a Staff Sergeant with the Brockville Police Service. I supervise the Detective Office, the Forensic Identification Unit, the Court Bureau, and the Drugs and Intelligence Office. And I've been a police officer since the 1990s. And over the last, I would say 15 years, the drug activity on the streets has drastically changed from when we were growing up as kids and in high school. No longer is marijuana, alcohol, and hash the drugs of choice on the street. They're now dealing with opioids. In the late 2000s, the opioid crisis really hit the streets of Brockville. In an apartment on King Street, there were 2 overdose deaths from opioids. 2 persons, one a young boy by the name of Dustin King died at 17 years of age. The drug of choice at that time was Oxycontin. At that time, they were diverting prescriptions on the street. Some 11 days later, in the same apartment, a 41-year-old former nurse who became addicted to opioids, using it as a painkiller, passed away as well from a drug overdose. And from then on, the drugs on the streets changed in the city of Brockville. Today's the picture is far different. In September of 2018, we had a number of serious incidents in the city of Brockville. We identified kids as young as 13 years of age were using opioids. In 2020, in Lanark, Leeds, and Grenville, there were 165 overdoses reported, a far cry from what they were in the early 1990s. 85% of those 165 contain fentanyl. Already in 2021, from January 1st to March 31st, there were 14 reported overdoses investigated by the Brockville Police Service alone. That doesn't include those presented to the ER who went to doctor's office or didn't report at all. In all, 9 of those 14 were used under the age of 25, one as young as 15. This is a crisis that law enforcement isn't going to solve. We're not going to arrest our way out of this. The new drug on the street, in addition to be illegal and very dangerous, there's associated violence involved and criminal activity, including organized crime. Drug dependency on our streets is a public health crisis and requires a community response. So what makes it so dangerous? Well, fentanyl only requires 1 dose to be fatal. Unlike prescription drugs, not each dosage of fentanyl is measured out. So while you may get several doses that are not lethal, it only takes one to have that lethal amount. Those who become dependent on fentanyl require more and more and more of the drug to achieve the same high. It's easily available on the street. In the early 2000s, when opioids started to hit the street, organized crime discovered that it is very addictive, and there's a huge market for it. And wherever there's a market, there will always be a supply. Outlaw motorcycle gangs in the Brockville area have discovered this and have made a home in Brockville because they have a large market to sell to. And with drug dependency also brings associated crimes of violence. They include both physical and sexual violence, including human trafficking. And yes, it does occur in Brockville. So what are the signs and symptoms of opioid abuse and dependency? You'll notice failing to fulfill your responsibilities at work or school. So homework which used to be done, or grades that you used to achieve, they're not being achieved anymore. You'll have negative social consequences. So those friends that you used to hang around, you're no longer hanging around them. Activities that once were found to be enjoyable, they become less enjoyable. So if you were into drama or into music or physical activity, all of a sudden you start to become disinterested in them. When trying to kick the habit by themselves, they'll become ill, and they'll become physically ill, trying to avoid the drug. You'll see signs of intoxication, where they'll start to nod off for no reason at all. And you'll notice that people and friends of yours who always had a little bit of money with them no longer have money with them. And you'll see physical signs, like they'll start scratching for no reason, or picking, as what they call it on the streets. So what can we do? Well, we can talk openly, both parents and youth, about the drug abuse that goes on in the community. Create an environment for youth to talk openly and come forward if they have a problem, so that they can admit to a problem and get help. And talk about that critical time period for youth, from the time that they leave school until parents arrive home from work. Fill that with healthy and worthwhile activities. Also, one final note before I move on, the federal government passed the Good Samaritan Drug Overdose Act, which provides some legal protection for people who experience or witness an overdose to call 911 or local emergency number from help. The act protects persons from legal liability and protects them from charges of possession of a controlled substance or breach of release conditions, probation orders, conditional sentence, and parole. I think more needs to be known about that act so that assistance can be provided, because oftentimes people who witness overdose become scared that they're going to get arrested or get in trouble for it. The Good Samaritan Overdose Act protects them from legal liability. That's all I had.
Okay, I'll maybe pass it over right now then, Jen Adams from the health unit to talk a little bit further here.
Hi, Jen, your mic might be muted.
Okay, apologize for the technical difficulties there. I'll now introduce Christine Dinnery, counselor with the Opioid Clinic, to talk a little bit about access for support services in the community.
Hi, so I'm Christine Dinnery and I work for Lanark, Leeds and Grenville Addiction and Mental Health, and I am the counselor in the opiate program. So basically, just following up kind of with what Tom said, is that we're seeing a significant increase in the toxic supply that we have, and definitely encouraging our youth and people in our community to start having the conversation. And of course, part of that conversation has to be looking at support programs and services that are available, not only to our young folks, but to our adults as well. So I work out of the Change Health Clinic, which is an opiate replacement therapy to help those who are coming off of opiates.
I work for Lanark, Leeds and Grenville Addiction and Mental Health, and I am the...
Sorry, I'm getting feedback. So one of the things that we offer at the 3 clinics, so located in Brockville, Smith Falls, and Carleton Place, is a full walk-in service. So there's no appointment needed. You just walk into one of the clinics, let staff know that you're looking to connect with somebody, and they will get you connected with either myself or the 2 case managers that I have working with me. And we can start talking about what treatment may look like for that individual, and then offering family support. We have a full-time family support worker out of our main office, and we work from a harm reduction philosophy, so using harm reduction as a form of psychotherapy. And it really means that we're working with folks from where they're at. Like everything else, our ultimate goal is to achieve abstinence, but we don't start with abstinence first. And we talk about what's working for that individual, what's not working, and we provide a full wraparound service. So working with folks like Jen from the health unit, Jess Bashara from the peer navigation perspective, case management, nurses, and of course physicians. So it's a full program, and again, it's accessible to anybody who is struggling with an opiate use disorder, or even just dabbling, or even wanting to know how to talk to their kids or their loved ones about opiate use and what that would look like for them and for their family. So if there's any questions or people have concerns, they're always welcome to contact Lanark, Leeds and Grenville Addiction and Mental Health, or myself at the Change Healthcare Clinic.
We're going to move on right now with the presentation of some of the work that's being done in our schools. And the slide deck is, I believe, up on the screen there right now. So Derek, if we can just move to the next slide, please. And following on some of the work that Christine was just talking about in the community, you know, certainly prevention is very much a big key in terms of what we're doing in our schools, and that both in looking at, you know, some of the discussions that we're having either as part of the curriculum or on specific supports with some of our students. If we can move to the next slide, please.
Hi, Don. So I can present on this slide. It's Michelle Neville, the mental health leader with the CDSBEO. So these are just some of the prevention programs that we have in place in our schools. So programs like the Zones of Regulation, the Umbrella Project is another one, and Sources of Strength. So obviously in the school environment, prevention is really a great mode of supporting the kids because they're all there. So we use programs like this to kind of build in resiliency and teach kids about healthy coping early on and starting from very young. Do you want to go on to the next slide?
Don, your mic's on mute, so I'll just get you to unmute. Thank you.
We have in our boards where Link Crew is a program where we have senior students supporting students as they come into our schools, either at the grade 7 or grade 9 transitions. As well, the province have been doing a lot of significant work that both of our school boards are working, partnering with School Mental Health Ontario and the supports that they can provide for teachers, for parents, community members, and for our students.
Then our society of support staff in place to help kids, either to support prevention efforts, like the ones that we mentioned, like the Link Crew, or help facilitate sources of strength, or the Umbrella Project. But then there's also other support. So when kids are struggling, they have somebody in the school to turn to. So for example, there are student support workers in the schools, mental health and addiction counselors, in our Catholic schools, chaplains in the secondary schools, behavioral crisis consultants, or student support counselors, and there's also access to a specialized team, including an occupational therapist who is passionate about mental health.
We've been developing grade-by-grade specific resources on substances, misuse, and harm reduction. These are all tied to expectations in a grade 4 to grade 9 health and phys ed curriculum, both in French and English. And as well, there are resources being provided for students, school staff, and for parents.
And then we've also worked with our community partners to develop a guide for working together to respond to children and youth struggling with substance use, addictions, and mental health concerns. So together, those are some of the resources that we have in place in our schools to help ensure that people know what to do and where to go when a student is struggling with substances.
As well as it pertains to other behaviors related to smoking and use of vapes, we work closely with our local health units, ensuring that the information that schools have is reliable and evidence-based in terms of the prevention and the support initiatives that are in place.
And we also work closely with our school-based mental health and addiction nurse friends, because we have some nurses that are assigned to the various schools, and they support our kids right from junior kindergarten all the way up to grade 12. And so anybody who is struggling with substance use is a perfect candidate to work with our mental health and addiction nurses.
In terms of working with some of our community partners, Planet Youth in the Lanark community is a project that our boards are partnering with together as a community school board initiative.
And these are some additional community resources that we actually have a partnership agreement with to work closely together. So R&J Youth Services, Lanark, Leeds, and Grenville Addictions and Mental Health Services, Children's Mental Health of Leeds and Grenville, did the Dave Smith Youth Treatment Center, and Open Doors. So those are the community partners we work really closely with throughout Lanark, Leeds, and Grenville.
And more recently, the Ontario Lung Health Foundation, over the past year, have been starting to work more closely in terms of tackling the vaping epidemic that we're seeing with schools, providing some resources, again, for supporting all students, with also some focused initiatives to support the students that are having the greatest difficulty in these areas.
Perfect, and that is it for us. So this has been Michelle Neville, the CDSBO Mental Health Leader, and Don Lewis, the Superintendent for the Upper Canada District School Board. So I'll turn it back over to you, Don, as the MC for tonight.
Thanks, Michelle. And just trying to check with Jen Adams if you've been able to unmute to share things from your perspective here as well. Okay, we're going to move on and start to answer some of the questions that have been posed. I would encourage folks that are watching this right now, if you can send your questions in, and then we'll attempt to get these answered by the various members of our panel. I'll pass this first question over to Tom as part of our panel. First question, how much connection do youth have with, to your knowledge, how much connection do youth have with drug traffickers, and how are drug strategies in place helping or making a difference in our community?
Hi, Tom. I think you're still on mute.
Okay, we're actually going to hop back. Jen, I want to check to see if you're now able to present.
Hello, I'm back on.
Yeah, we can hear you now.
Oh, perfect. Sorry about that. Do you want me to just go ahead?
Absolutely, yep.
Okay, so Jennifer Adams, I'm the harm reduction coordinator with the Lanark, Leeds, and Grenville Health Unit. I think I want to build on what Tom was speaking to earlier. I've been in this role for 11 years, and I cover all of Leeds, Grenville, and Lanark, and I definitely have seen a shift in the last 18 months, particularly in the Brockville area around the substances that we're seeing at the street level. I would reiterate Tom's conversation and his points on the fact that we're seeing younger and younger ages. Typically in our harm reduction programs, we would see folks averaging age of 35 to low 40s was what we would see 5 years ago. Our average age for both men and women have dropped significantly into the lower 20s in the past 18 months. I definitely would say that overall, the substance supply, not only in the Brockville area, but across Leeds, Grenville, and Lanark, and across the rest of the province, is highly contaminated with all kinds of other substances, not just opioids. I think one of the most important messages that we need to get across to our kids is that it's not just fentanyl. We know that most of our substances in our area are also contaminated with opioids. So things like the cocaine supply, crystal meth, amphetamines, all are coming back positive for both fentanyl and another substance, which I think that people need to be aware and is relatively new in our area, is something called Benzodiazepines, which are typically anti-anxiety medications. Contaminated with opioids. So things like the cocaine supply, crystal meth, amphetamines, all are coming back positive for both fentanyl and another. Sorry, I'm getting a little bit of feedback there. are all coming back positive, like I was saying, for benzodiazepines, which are anti-anxiety medications. And we're not talking about prescription anti-anxiety medications like Xanax and lorazepam, Ativan, those kinds of things. These are unregulated manufacturing of benzodiazepine-like substances that we are continuing to see in both the fentanyl that we're testing down at Change Healthcare, which is the methadone clinic, as well as things like methamphetamine and those kinds of things. So I think for the messaging for our young folks out there is that we have to be operating under the assumption that any substance not purchased through the pharmacy system is likely to be contaminated at this point. One of the reasons why we're most concerned is that we do have access to naloxone, which is the drug that will reverse an opioid or fentanyl overdose, but we don't have access right now to the drug that would reverse a benzodiazepine. This is only available through the hospital. And again, why it's so important that if there is an overdose situation happening, that people need to call for help, because the likelihood of those substances they're using having a benzodiazepine as well as an opioid are very high. And of course, this will increase your risk of having a fatal overdose substantially because we don't have the drug reversal medication on this available to people right now that they can pick up through our harm reduction program. I think that's probably just looking at the time, hoping that we can get to the questions. I think I will leave it at that.
Maybe if you just want to comment for folks if they are looking at wanting to find out where they can get naloxone in the community.
Oh yeah, absolutely. So there's several avenues that you can get naloxone, and naloxone comes in two different administration forms. So there's the injectable naloxone, which is still available. We don't see it as frequently as the nasal spray, and so people can access both of those medications either through the pharmacy system, or you can access it through the harm reduction program, which is available at the health unit in Brockville. That would be the one up on Laurier Boulevard, but it's also available at Change Healthcare, which is the methadone clinic down on King Street, and you don't have to be necessarily a clinic client to access naloxone there. It is available to anybody.
And if you can maybe just comment just quickly upon the administration of it, and also some things to consider if somebody is coming across somebody that they feel might have been suffering from an overdose in terms of initial first aid and calling 911, et cetera.
Absolutely. So with all naloxone administrations, and naloxone, I think we need to make sure we understand that it's not the be all and end all. I honestly would hate to see what our numbers of fatalities would look like if we didn't have access to naloxone in the last 4 years. I think we could be looking at dozens and dozens of more fatalities. So it is a good tool that we have, but it really buys us time to get someone to the hospital to get further medical care, because we know most people will require further medical care. So there's 5 steps to administering naloxone. Shake, shout. If someone doesn't wake up, they're in trouble. And most of the time we're looking at folks that are unconscious, they're not breathing. It is a true respiratory arrest, so it means that the breathing stops, but eventually once breathing stops will lead to a cardiac arrest as well. We want people to call 911 because we know that the outcome when calling 911 is definitely better for people. Most people do require ongoing naloxone through the hospital as well. And then administration of naloxone is step 3. Nasal spray is easy. I think probably for most people that's the go-to that we should be looking at people getting their hands on. It's administered through the nose. It is 1 dose per application. It is a substantially bigger dose of naloxone in the nasal spray than in the injectable. The next step is CPR. If you're able, trained to do that. Unfortunately, during COVID, And as long as COVID is we're in the pandemic state, there's no rescue breathing right now. So it's simply chest compressions until EMS arrives or you're too tired to continue. And then the next is, will it work? Generally speaking, it should work typically after 1 to 2 doses, but you can continue to administer doses if you have them available to you every 2 to 3 minutes until EMS arrives if the person is not waking up. We do provide training, so if anybody's interested in kits, I would highly recommend coming down to the health unit or Change Healthcare. We are continuing to do face-to-face trainings. Even though COVID times are happening, we know the importance of making sure people feel comfortable and are well trained in how to administer naloxone.
And Jen, a couple more questions related to naloxone right now. Knowing that sometimes there's an expiry date on it, if you want to comment about the length before it expires. And then also a second question from somebody logging in from Smiths Falls is wanting to know some suggestions for where to get naloxone kits in the Smiths Falls community.
Absolutely. So yeah, most the naloxone does have an expiry date. Most of what we see is about 18 months expiry dates. Now, having said that, if an expired kit is all that you have to work with, it's better to administer an expired kit than to administer no kit. We know that survival rates when naloxone is administered is 80% or higher. And so our recommendation is that you do keep an eye on your kits. If you have them at home, check out their expiry dates. There's no cost to replace them. Just bring them back to the pharmacy or us at the health unit and we will replace those. But again, if that's all you have available to you, that's what you use. As for naloxone in the Smiths Falls area, so again, the health unit, we're on 25 Johnson Street across from the hospital, the main entrance of the hospital. You can also acquire a kit through Change Healthcare in the Giant Tiger Mall as well. And then there are several pharmacies in our area who also are administering naloxone. Shoppers Drug Mart for sure does. So there's lots of options for people.
Okay, next question to be posed. Not sure if this would be more for Christine or for Jen. If you can comment, since the legalization of recreational cannabis took place in October 2018 in Canada, have you seen an increase in fentanyl abuse disorder with that or not? And maybe potentially tied to that, maybe a comment on how sometimes cannabis is perceived as a gateway drug to harder drugs.
So it's Jen. I can take the first part of that question for sure. I don't think the legalization of cannabis has had anything to do with the increase in fentanyl use in what we're seeing. The reality is that we as a society and I think as the government, we felt that OxyContin back, 5, 6, 7 years ago was and it was causing lots of fatalities. And so the government chose to crack down on that, which then led into the fentanyl patch issue, where people were using and misusing fentanyl patches. And so and again, that was also causing people to die from that. And so we cracked down on that as well. And so the reality of substance use and dependency is that until we deal with the ongoing underlying issues of why people use substances, the more we crack down on substances, we just continue to move the problem elsewhere. And so as we clamp down on the fentanyl patches, we open the gate to these illicit powdered fentanyls and that's the reason why we're in the mess that we're in right now, is that every single time that we clamp down on a certain substance, we just move the problem to a new substance. So if we crack down on these fentanyl powders, and if the government does continue to do that, we're going to then see this problem migrate to a different substance. So until we deal with the underlying root causes of addiction and dependency, we're just constantly moving the problem elsewhere.
Okay, next question, I'll pass it over to Marcia McNair to answer this one. If you can speak to some of the naloxone training that is going on in schools.
Thanks, Don. Good evening, everyone. Yes, we continue to partner with our public health partners and provide naloxone training to our administrators at our schools to ensure that they have the knowledge and understanding of the use of the kits. We then ask our administrators to work closely with their school staff to share that training. And in some particular cases, then some of our staff will work embedded within, for instance, our health, physical education and health curriculum, so we can share that learning with our students. We also certainly encourage our schools to advertise where the naloxone kits are kept in the schools, so students know that they can reach out at any time. We would have various locations in different schools, but one would certainly be our main office, and that would be where we would house the kits and be able to keep track of the expiry dates on the kits as well. Thank you.
Okay, another question from a school perspective, maybe Norma, if you want to answer this one, if you can talk about schools, online programs, in terms of talking to opioid use and where students can come for help.
So with respect to the online, Dawn, if I'm understanding the question correctly, I think, you know, we are looking at, now that we are doing online learning in most of our schools, certainly now during the school closure period, we are still providing a lot of supports from staff into our classrooms through either assemblies, through being able to address particular topics, whether it's within health classes that are attached to phys ed, whether it's topics that come up in class. And what we've been able to do is to deploy the appropriate staff and also our community partners to still be supporting online, even when we were in-person learning, but certainly with COVID restrictions, we also had our community partners deemed essential to our schools, and they've still been able to come in and work with small groups of students to perhaps do counseling if that's something that started in the community that we then allowed to continue within a school setting in, you know, smaller areas of our school, and we've continued to do that. So I think that collaboration and that working together, certainly with community partners, still providing opportunities for them to be present in our schools, either online or in person, is certainly part of it. And one of the things that was mentioned here this evening, just if I can talk about certainly the topic of vaping. This is something for us certainly in schools that is very much a very hot topic in terms of what we do there to try and prevent and educate and try and you know, deal with the addiction that some of our students have when it comes to vaping. Vaping is something that, you know, unlike cigarettes, it can be easily hidden, it can be, you know, disguised in things as well. So we are working very closely with the Lung Health Foundation, and that's to leverage some of the work that we're doing in the area of cannabis edibles and vaping and recreational cannabis. And what we have in that partnership with the Lung Health Foundation is to gather knowledge certainly on what the current needs are in the communities with our students, and through this collaboration we're hoping to create again that expertise, those small groups, and being able to provide supports you know, such as mental health or some of the police protocols on cannabis and vaping in schools. So again, it's a multifaceted answer, Dawn, and I don't know if I've hit all of the things, but if you need to redirect me, please feel free to do that as well. Thank you.
Okay, thanks, Norma. Another question coming in around, and I know that this is something that used to take place in schools, but around the use of bringing sniffer dogs into schools. This is no longer permissible due to the fact that it's considered a form of a random search on students when they were brought in. I think it's probably been going back to when it was in schools as a principal, would probably be about at least almost 10 years ago now from when that was permitted. I'm going to pass the next question over to Tom. Working with the harm reduction model and with the work that's being done by the municipal drug strategy in the community, if you can talk about whether or not we've seen discussions around opening a shelter as opposed to the warming center in the winter.
Can you hear me okay now?
Yes, we can. Thanks, Tom.
Okay. The topic of a warming shelter versus a permanent shelter goes on quite frequently. The biggest hurdle is securing funds in a location for a shelter. I think most people are in agreement for the need of one. The warming center was well used over the winter time, but it does create a vacuum during the daytime, especially when we're in lockdown restrictions. So there's several hurdles to overcome. Where would we locate the shelter? Various municipalities have zoning bylaws as to where they can be housed. They have to be approved by the fire department, the building inspector, and the health unit to be operable. And then there's also the debate over are we better off having small shelters in each community in Lanark, Leeds, and Grenville versus one in a large center like Brockville when we're comparing it to Lanark, Leeds, and Grenville. So there are some hurdles. I think everybody is on board that I've spoken to that there's a need for one. There's just some obstacles and hurdles that we have to overcome. The biggest one being funding because they're very expensive to run. So I think we're working towards it and continue to discuss it and trying to achieve that goal.
Okay, I'm going to pass the next couple of questions over to Michelle. First of all, talking about how organizations such as the YMCA and other community organizations can or are working together to support our students in terms of supports with programming, especially during some of these times right now related to, during the COVID lockdowns and so on. Michelle, I'm not sure if you might be muted there. Okay, I'm going to pass a question maybe then over to Jen. Question more specifically again about benzodiazepine overdoses. Is there anything to do other than in terms of administering first aid prior to calling 911? And how might somebody see an overdose due to benzodiazepine as different from fentanyl or from another drug?
Can you hear me okay, John?
Yes, we can. Yep.
Okay, perfect. Yeah, so the benzodiazepines, and this is where it becomes very tricky. Benzos and opioids or fentanyl are all part of the same drug category. Same with alcohol. They're all depressant drugs and substances, and so they all will appear in an overdose situation to be very similar, which again, unless you have been able to drug test or check the substance itself to see what's in it, you may not necessarily know that. And so we always urge people to err on the side of caution. If someone is unconscious, you're not going to harm anyone by administering naloxone, because the likelihood is that that substance that they use contains more than just a benzo or more than just the fentanyl. And so we do recommend that naloxone be administered. It will work if there is an opioid on the opioid portion, but really for a benzodiazepine overdose, it will require medical care through EMS and the hospital. You absolutely can perform CPR. It will they mimic the same as unconscious respiratory arrest, a cardiac arrest. And so CPR is a good alternative and recommended to do. But at the end of the day, that person is going to need probably the drug reversal medication that's available in the hospital to be administered as well. And so we really encourage people to call 911.
Sorry, Michelle, I just want to make sure we have you on there.
Yeah, can you hear me better now?
Yeah, we can. Perfect. If
perfect.
you can maybe talk about the ways that some of the social services agencies like the YMCA and other community partners are working to support some of our vulnerable youth during these times.
Yeah, so I started answering the question, and then I guess you guys can hear me. But I was just saying that even if the programs like the YMCA or the library or various community partners offer programming that it doesn't even need to necessarily address cannabis use or vaping per se, but even just offering kids that opportunity to get involved in their community and as best we can right now, kind of foster relationships, whether it's virtually or once we can meet in person again, but just having opportunities for kids to feel engaged in their community and to have opportunities to do different programming and things. That in itself does a lot to prevent substance use. So that's basically the premise of the Planet Youth Initiative that is starting up in Lanark. And so in working with our community partners, I think that's a really key ingredient is having all those different programs that kids can tap into. There's a really good quote that comes from core addiction practice. The training that we offer the teachers, and basically it says relationships is like a vaccine for substance use. So having strong relationships and providing kids opportunities for connection as best we can during this difficult time is really key to helping prevent substance use.
Okay, next question might be for yourself, or it might as well potentially be for Christine. And I know Norma talked a little bit earlier about the vaping epidemic, but also the fact of sometimes students using nicotine as part of that. And maybe either for parents or for teens wanting to seek support with the nicotine habit. How can parents struggling with a vaping teenager handle things from a harm reduction perspective?
Yeah, absolutely. So anything harm reduction, it's obviously not you won't do drugs, right? So harm reduction is about teaching people about the benefits and risks, and hopefully more so the risks of whatever it is that they're engaged in, and working from there to try to decrease the use. So the ultimate goal, of course, is to stop use, but sometimes that's not what we're working at first, right? So with the harm reduction, when it comes to vaping, a lot of it goes, and public health can probably speak better to this, but just decreasing use to start with. So having a child or youth needs to be in a position where they want to change, right? They're not going to change if it's just parents telling them you need to change. So the first step is helping them to recognize why they might want to change. And so helping them go from that pre-contemplation where they don't think it's a problem to the next step, which is contemplation in stages of change. And recognizing that maybe, it's expensive, or I'm losing friends, or my marks are going down, or just different reasons why they might want to look at changing their behavior. And then from there, coming up with sort of a gradual way of decreasing something. So if it's vaping or smoking cigarettes or, eating edibles, cannabis, just decreasing the amount slowly that they're using. And another good resource that I just wanted to mention is Clio, so the Parents Lifeline, which is a free resource in this area. And it's basically parents helping parents. So parents who are currently struggling with a youth, say, who's vaping a lot, you can call Clio, and maybe somebody can put it in the or the moderator can put it in the just the number. It's clio.on.ca. But you can go on their website and look that up, or maybe the number can be posted, but you call that number and then you are connected with another parent who struggles with that themselves, but has now overcome it. So it's a lot of hope. And so they're not social workers or counselors, but parents that have that lived experience, which is really helpful sometimes. And then the Kids Help Phone website and resources is another one that I wanted to kind of do a plug for. And on that website, if you go to kidshelpphone.ca, they have lots of information there that's very youth-friendly about vaping and cannabis, and it's all told from like a kid lens, because they always work with children and youth when they're developing their material. And then it's a helpful reminder too that that kids can turn to Kids Help Phone if ever they're struggling with anything.
Okay, thanks, Michelle. Tom, I'm going to pass the next question over to you. If you can talk, and maybe related to some of the work of, is tied to the local NDS, but in terms of community partners and, how are different elements of the community coming together to address some of the underlying causes of drug use, especially as well how it relates to some of the prevention work.
So there's 5 pillars of the municipal drug strategy, one of them being prevention. Prevention deals with trying to build assets for youth and giving them alternatives towards, than to turn towards drugs. They include groups such as Every Kid in Our Community and the Community Youth Initiative. They look to support activities in the community such as programming at the library. The Stingers After School program was another one. Why Youth Nights, such activities as that. Even promotion of youth programming changes at certain community groups, such as the Theatre Guild and Operatic Society, and things like that. So the main prevention program is to build assets to have an alternative to drug use, and to try and get activities, especially after school activities, in that critical time between the time school is out and parents come home from work. That's the prevention pillar. The other prevention pillar is exactly forms like we're doing tonight. It's an education. To promote open discussion in a family with regards to drug use and the prevalence of drugs in our community, and education about how dangerous drugs are, and how to seek help when one is suffering from drug dependency. Those are the assets that we're trying to build right now. We're continuing to build that. We always look for volunteers, and we always look for people to come forward with new ideas. But we have to build on that to prevent the next generation from turning to drugs.
Okay, thanks, Tom. Next question, going to pass it over to Jen Adams. If you can talk about the percentage or portion that you're seeing of opioid and benzodiazepine substance abuse that comes either from medical prescriptions or that comes from the black market.
That's a tough one. I don't have any statistics in front of me. I'm sure there are statistics out there. I think what people need to understand is that the overdose crisis, the opioid crisis, is no longer a prescription drug crisis. Initially, when 5 years ago when we started sounding the alarm, it really was a prescription drug crisis. It was the vast majority of fatalities that we were seeing in the area were caused by the misuse of prescription medications, and that's no longer the case. The vast majority of the folks that are experiencing overdoses in our area are caused from fentanyl powders and the black market illicit drugs that are circulating. So I mean it's definitely a tough one, but I think we've moved well beyond a prescription drug crisis, and we're really in. And the reality is this is not an opioid crisis. we're in an overdose crisis right now. Again, it continues to escalate. The numbers for 2020 we haven't got them out yet. We've seen them tentatively, but they are significantly worse than they were in 2019, and 21 looks to be worse than 2020. And so we are dealing with an overdose crisis, a preventable overdose crisis.
Okay, thanks, Jen. And one final question, and I'm not sure if this might go to either Michelle, Jen, or Christine. In terms of vaping use for students who are using it over a longer period of time, is there a general indication that students will ultimately be ending up with lung issues as a result of extended use?
So can you hear me okay, Don?
Yes, we can, yep.
Okay, perfect. Michelle here, I can take a stab at the answer. And then Jen, feel free to comment as well. But there's definitely been a lot of research and some, lived experiences, unfortunately, in the hospitals with demonstrating that absolutely vaping products can damage the lungs. And like anything, the longer you use and the more you use, then the worse off it is, right? So so definitely with extended use, you can, because of the nature of the products that are in the vape, you can definitely cause damage to the lungs. Jen, do you want to add to that?
Yeah, I'll just add to that. I think probably and vaping is not my expertise by any stretch, but what we do know is that youth who start vaping are more likely to switch over to cigarette smoking. And so that's becoming more and more commonplace. We are starting to see more youth who are beginning to smoke cigarettes who have initially started in vaping. And so we know what that looks like long term for folks that start smoking young. So I think we can make some, correlations to, long-term smoking use with initially starting with vaping use as youth.
Okay, thanks, Jen, and thanks, Michelle, and thanks to everybody for joining us this evening for this community forum on fentanyl use and what we're seeing and how it is impacting our youth. Special thank you to all the members of our team at Marsh McNair from the Upper Canada Board, Norman McDonald and Michelle Neville from the Catholic District School Board of Eastern Ontario, Jen Adams and Jess Bashara from the Lanark, Leeds and Grenville Health Unit, Christine Dinnery from Lanark, Leeds and Grenville Mental Health and Addictions, and Tom Fournier from Brockville Police Services. My name is Don Lewis, and thank you everybody very much for joining us this evening.